Today in this video I'll be talking briefly about platelet-rich plasma, PRP. You must have heard a lot about PRP. So what is PRP, how it is done, how it works, why it does not work in some people, how frequently it is to be taken, and are there any potential side effects associated with the PRP? I'll cover on these topics. First, what is PRP? PRP stands for platelet-rich plasma. So there is a cell called as platelet in our blood which will contain a lot of growth factors. When these growth factors are injected into the scalp, they will help in growth of the hair tissue. This is the logic behind using PRP onto the scalp. Now, let's imagine that you're shaving and you end up getting a tiny injury on your face. You don't really have to get it sutured if the skin are closely approximated with each other. The body has a self-healing mechanism. When there is a tiny cut, let's assume there is a tiny cut on the face, and there will be immediately redness, pain and swelling. This is called as inflammation. This inflammation or inflammatory signals will be gone to the brain, telling that there is a damage that has happened, and the brain will immediately send a lot of platelets to that part from inside, which will help in healing the wound. Now the same thing should have happened, and the same thing happens anywhere in the body. If there is a tiny injury, minor injury anywhere that happens in the body has a self-healing mechanism, and this is how it will be healed. The same thing should have happened when your hair was becoming thin, but the problem is thinning of hair doesn't happen with any pain or swelling or inflammation, which means this is a non-inflammatory damage that is happening. In this case of non-inflammatory damage, there is no inflammatory signals that are being transferred onto the brain, so that it will never ask for help. So in this kind of cases, brain will never think of helping them by sending the platelets. So what do we do is, we take out the same blood manually outside using a centrifugation machine. We'll centrifugate it, take out the growth platelets, which will contain a lot of growth factors, and these growth factors will be injected into the scalp at particular depth, particular distance and at a particular angle. By doing this, we will reach the hair follicle base and the growth factors will be injected there. These growth factors which reach the follicle base will cause vasodilation, will release vascular endothelial growth factors, platelet derived growth factors, lot of growth factors would be there, which will help in regrowth of a hair which is about to become thin. Okay, so this is how it will work. So where it does not work, you might have heard these kind of advertisements where they show a bald man and then getting the PRP injections, and the immediate next photograph will be whether it is the same man or different man, I don't know, he'll be having a head full of hair. This is fake. Why it is fake? Because if a person has already become bald, it means the follicles have already vanished there. By injecting PRP, you will not get a follicle back. Only the one which is thin will become thick, right? So don't fall for these kind of traps. So if a person has already lost the follicle, like example, if I had to talk in my case, these are the areas where the follicles have already vanished. Here injecting PRP will not do any help. So don't plan for PRP if you are experiencing this kind of baldness. How frequently to take? There are a lot of discussions happening regarding how frequently to take and what are the number of sessions. Even these kind of discussions keep on happening even in our conferences. But ideally, that has to be done once in 4 weeks. So once in a month. And it has to be around 6 sessions. Continuously 6 sessions if it is done, we get to see good changes after 100 days again. The first 3 months you don't see any changes. After that you start seeing the change. Once the 6 months duration is completed, you will continue with the topical minoxidil or any other medications as advised by your dermatologist, and later, let's say around 6 months later or 1 year later, if required, you can take 1 session. That would act as a maintenance dose, and that will help in maintaining for next 6 months and all that. So is PRP a way to prevent baldness? Again, no. PRP is a way to only postpone the baldness, not completely prevent it. What are the side effects? Side effects depends on who is doing the procedure and how he is handling. See, any sort of medical procedures or medicines are like knife. If I ask you a question, is knife safe or dangerous? The simple answer would be, it depends on who is handling it. Handled by a sane person, yes, everything can be used to cut vegetables. If it's used by an insane person, he'll end up cutting the fingers. So if it is done by the trained person like a dermatologist or a plastic surgeon, it is safe. Again, done by some random technicians or someone, it can lead to neurological issues or it can lead to long-term complications.